Hey, how you doing? This is day 4 of my Medtronic's spinal stimulator trial. Um, if you've watched the other videos, yeah, you know what's been going on with me. But just to recap, everything actually is pretty good. The only issue I have left is pain in my knees, where I have what I believe is pinched nerves. So things like moving my knees in odd directions, like getting in and out of the car, trying to put on socks and shoes, things like that, the nerve gets pinched. And also, I have a lot of numbness in my feet, especially at night when I lay down. So, I talked to the rep today, and he talked to my doctor, and they decided to change my therapy a little bit. Actually, it's kind of a lot to ramp things up. So now I've got a setting that makes my uh, legs, probably from mid thigh down to my toes, kind of tingle. And but it I've only had it this way, the setting, for maybe 7 hours, and I've been able to kind of do or try to do things that I haven't done in a long time, like cross my legs or try and get my right leg up to the point where I can put on socks. Um, Getting up, sitting down, getting out of the car. It's all been pretty. I won't say effortless, but actually going pretty well. So I think that this ramp up has really done a lot. I'm going to maybe put it up a little bit higher because I still have numbness in my toes. So I'll do that tonight, maybe before I go to bed, and lay down and ramp it up then. But other than that, things are going good. We shall see. I've got an appointment tomorrow to go in, and uh, it was supposed to be to stop the trial and have the leads removed. I really want to extend the trial for 2 more days. Usually they go 7 days, and the rep was kind of surprised when mine was only 5. So I really don't have a lot of time to check this new setting. And if you have to go through all of this, putting an extra few days in, um, it's no loss. It's all, in my opinion, gain. So I just got an email from the rep. He had talked to the doc, and the doc wants me to still come in tomorrow, and we'll discuss things, which I think is fine. I like the doctor. I I appreciate his opinions and advice and everything they've done. So um, it's no skin off me to take some time and drive in and talk this thing out. I want to make sure I get the best solution, possible. One thing I asked the rep today, I think I might have mentioned it yesterday, that I'm kind of concerned when they take the trial stops and they take the leads out, that I kind of return to my old self, which I'm not really looking forward to because I'm kind of getting used to my new self. So I asked him, I said, this might be bad timing to ask this, but uh, what's the normal time between stopping the trial and having the implant put in? And he said normally 3 weeks or 4 weeks. It just depends on what the surgery schedule is, what the doctor's availability is, etc. So that's a question that I'll ask my doctor tomorrow, and see if I can get them pinpointed down. Because if I decide to go with this, then you know I want to get relief as soon as I can. I mean, I've already waited 8 months to have the trial. Um, I just hate to have to wait another month to have the implant put in, the final stimulator. So we'll see what happens tomorrow. Um, but right now I'm feeling pretty positive. Um, I'll test out a few more things tonight to see how my knees are doing, see if I can get the numbness to go away in my feet. It's really worse at night when I sleep, and and numbness can be a little bit painful. So I hope that it isn't. But at least my knees aren't doing what they used to do. So anyway, I will see you all tomorrow, or see you tomorrow if it's only a you. Um, I hope this has been helpful to you. Um, it's it's a lousy place to be in if you have to have one done. But at least it's hope that people can take care of pain. I should add that we had brunch with some friends today, and and this guy goes. He said, "Oh, I have one of those." I said, "You're kidding me." He had one implanted 10 years ago. So it's a Boston Scientific system, which and it's a 10-year-old system, and he wishes that they could update to something new. But it's really helped him out a lot. He's got really serious back problems. Anyway, I hope you're all doing well, and that you've had a good weekend. Um, we're waiting for Florence to hit in North Carolina next Friday, so hopefully that will spare a lot of people grief. It could be some seriously sad times. Anyway, enjoy your week, and I guess I'll be back tomorrow. I'll let you know what the doc said. Take care.